Welcome, and thank you for the privilege of being able to talk about all the mistakes I've made in trying to start coupled sim centers at two different institutions. Without further ado, I have no disclosures, and I'm a pretty simple person, so I needed to break it up into a couple different slots, even though it's a 10-minute talk. So when I was tasked with trying to put together a program and a center in Las Vegas now over 10 years ago, I had none of this, and I didn't have very much guidance, and so this is a culmination of the things that I kind of figured out on the way. I'm sure the other speakers have similar experiences, and I'm sure probably have better advice. But a lot of it has to do with the institution and the way that the department structure is that you're in. And then whether you build a sim center that's part of a multidisciplinary kind of group within the School of Medicine or the hospital kind of depends on where you're at. So when I was trying to figure out what to do, I needed a budget because most of the people who asked me to put together a program or a sim center thought it was just a bunch of fancy machines and then just go ahead and have the residents play on them. I had different kinds of ideas, and I wanted to kind of integrate things into a program and try to develop large-scale curricula, and I needed a budget for that. So the first people I kind of went to were my department chair, and then to the School of Medicine, and a lot of the things that helped me was to have kind of a curricular plan, have an outline or something that you can pitch. And so what I wanted to do is I wanted to kind of do world domination. I wanted to take care of the medical students and the residents. And so there was a lot of gaps in the curriculum with the medical school as well as the residency program. So I did have a lot of things that I could help with. What I found out is that with the American College of Surgeons Education Institute's Consortium, accreditation helps. So if you tell the higher-ups or the leadership that you're going to seek accreditation later on with your curriculum as well as your center, it does help show, at least for me, that I had a long-term and a long-range plan. And then so when I started off, my staff was basically one person. But as you grow bigger and you start putting on a program, you're going to need people to help. And then a title helps because for the first 3 or 4 years, basically there was no compensation for what I was doing. So SIM director kind of helped to put it on the CV and kind of inspired me to go forward. And then space. Full disclosure, space remains a problem for me, and now that I'm at Stanford. I have a nicer sim center, but I still can't find places to store things. So my office is still a place to store things. And then the kind of sim center that you start with kind of depends on what you have to start with. I had an old conference room that I start out with, and then as things progress and you become, or your program becomes a little bit more a integral part of the teaching program, then you can kind of help with developing more. And what helped when I was in Nevada was at the nursing school, there was also looking for a sim center, and so we collaborated to build one. If you can get things that are, especially if you're talking about a sim center that's associated with the surgery program, getting close to the ORs or in the hospital itself is nice. If you start a sim center and it's near, at a strip mall about a mile away, it's harder to get people to come if you integrate that into your residency program. How you want to build your culture for the sim center is also important. Do you want that to be where the residents sign out? Do you want that to be a workroom? When you're not using it as part of your curriculum, do you want to use it as a conference room? So these early decisions are things that we had to make in order to establish the culture of our sim center. And then on the right-hand side of my slide are things that, are equipment and things that I never thought I'd have to worry about, like what kind of tables and chairs and things that we get for the sim center. Do they go up and down? Do you want to make it multidisciplinary? Do you want to be able to use it for different reasons? And then do you want can you bring animal products into the rooms that you have? These are things that come up. And so at Stanford, I have a small sets of rooms, and we established the culture of having this as a resident hangout, a workroom, and a place for them to sign out, and less of a conference room. And so what we've been able to do there, and this was Dr. Crummel's dream, was to have this as a place where the residents would actually start teaching medical students and using the task trainers that we had in order to practice on their times when they're in between patients or at night. And that's kind of, after about 5 or 6 years, the way it's become. As we became more integral into the teaching programs for the medical students and residents, help was necessary. And then defining our mission for the Sim Center also was necessary. So the Sim Center runs because of the people that we have there. We have administrative staff that helps with gathering the teachers for our learners. And then eventually we added on a simulationist. And then for our research, which is mainly program evaluation, we have somebody that helps make sure that we're on the right page. And then I know this doesn't happen at other institutions, but it does at mine. Sometimes it's hard for us to find people to teach. I feel like half my job is getting people to come and teach. So we used our education fellowship less as a research fellowship and more as a teaching fellowship. And so we utilized our very enthusiastic residents who came for 2 years to become education leaders to do a lot of our teaching, and they design all the programs. And so now most of our programs are actually designed by them, run by them, evaluated by them, and that's the majority of our research platform is them. And then medical students also now want to become surgical education or educational leaders, and so we are having them also do a lot of our research and answering some of the questions. And this is all through a Sim Center, which when I started about 10 years ago, I thought was basically a room. But I guess if I had a theme for my talk, what I wanted to tell you that it's this what to ask for and how you start one is basically the program that you create and how you can fill the gaps of your education needs for the department, the School of Medicine, and your institution. So we first started off with the residency program and developed the skills curriculum based on the ACS, APDS curriculum, and then we went from there. Then we started taking over the clerkship, so the clerkship program is now also part of our Sim Center. And then the pre-clerkship courses, so my chair is concerned with pipeline, getting students interested in surgery. So a lot of our pre-clerkship courses are now run through the Sim Center and our personnel. And with all these courses that we end up doing, requires more equipment, requires more suture, and so in asking for a budget, we have to incorporate all of these in those different kind of categories. So when I ask for my clerkship budget, I incorporate a lot of things that we use for the students, sutures and skin pads and those kinds of things. And then for the residency program, because we have to help with fundamentals of endoscopic surgery and fundamentals of laparoscopic surgery, those equipment and those machines are pretty expensive. So I have to incorporate those into our budget for residency. And so our research infrastructure was basically created out of our curricula. So we don't have anything fancy. We basically just view what we've done with our program and see whether it works. And the residents have done an amazing job at publishing. So in the last minute that I have, basically, my suggestion when you're starting a simulation center is to present an agenda. So when you're asking for things, present your plan, how you're going to help, what users or what populations you're going to serve. And for me, it was helpful to have a long-range plan, and then I started small and went from there. And then the project just come out of the woodwork, and so these are some of the things that we're ending up looking at. And again, there's based on the curricula that we've been able to establish. And then the support for a lot of our projects came from the great ideas that came from the students and the residents. And so now our Sim Center is less of a center and more of a program. And these are just pictures from our interdisciplinary in situ simulation program that we've been able to build through the center. And I think I'm on time.
Thank you.